Hey everyone, Dr. Shaikh here from The Dentalist. Today we'll talk about ceramics and porcelain-fused-to-metal restorations. This chapter is extremely important because ceramics play a huge role in modern restorative dentistry, offering excellent aesthetics, biocompatibility, and of course, strength. We'll cover everything from the composition of dental ceramics to PFM restorations, CAD/CAM, injection molded ceramics, and advanced materials. So first of all, what are ceramics? Ceramics are inorganic, non-metallic materials made by heating raw materials at high temperatures. In dentistry, they are primarily used for their aesthetic translucency, durability, and biocompatibility. However, ceramics can be brittle, which is why various reinforcements and fabrication techniques have been developed. Let's talk about the composition of traditional dental porcelain first. So the traditional dental porcelain consists of feldspar, which is potassium aluminium silicate, and that provides the glassy nature and translucency to the material. And then there's quartz, which is silica, silicon dioxide, that gives strength and stability. And then there's kaolin, which is aluminosilicate clay that works as a binder but is used in very small amounts. And then there are metallic oxides that are added for shade and fluorescence. So these materials basically comprise to form the ceramic, right? So during firing, feldspar and silica melt and fuse to form a vitreous glassy matrix. The glassy matrix gives ceramics their aesthetic translucency, while crystalline phases improve the strength. So let's talk about compaction and firing ceramics. We'll talk about compaction first. The ceramic powder is mixed with a liquid, which is usually distilled water or modeling liquid, to form a paste. The paste is then carefully layered and compacted onto the die to ensure minimal porosity. Then the firing process starts, which is also called as sintering. The compacted ceramic is then fired in a vacuum furnace at high temperatures, like around 900 to 1100 degrees. During firing, fusion occurs and the particles bond, forming a solid structure. Now here you should know that the material basically shrinks about 20%, requiring accurate application of the multiple layers of ceramic. I hope you understand the compaction and firing process. Now let's talk about the properties of dental porcelain. The advantages are excellent aesthetics, and it mimics natural enamel translucency. It is biocompatible, does not cause allergic reactions. It has high compressive strength. It is stain resistant, and plus the surface is basically glazed for durability. The disadvantages are brittle and low tensile strength, which makes it susceptible to fracture. Ceramics basically cannot withstand excessive occlusal forces, which leads to chipping or cracking. And then one more important disadvantage is that it abrades the opposing teeth. Porcelain can actually wear down the natural enamel. That's the biggest disadvantage. Now let's talk about the advanced ceramic systems. Alumina inserts and aluminous porcelain come first when we talk about the advanced ceramic systems. Aluminum dioxide is added to increase fracture resistance. Aluminous porcelain has 35 to 50% alumina crystals in the glassy phase, making it 2 to 3 times stronger than the classic feldspathic porcelain. Another advancement in ceramics is the sintered alumina core ceramics. Now these are all advances and modifications in the original ceramic material to make it more stronger and durable and to minimize its disadvantages. Okay, just so you know. So the next ceramic advancement is sintered alumina core ceramics, which is also called as In-Ceram. These are basically high-strength alumina core ceramics that eliminate the need for metal substructures. It is basically fabricated using slip casting, and it's infiltrated with lanthanum glass. For example, In-Ceram alumina and In-Ceram zirconia. You must have heard these. Now the other advancement is injection molded and pressed ceramics. A famous example for this one is IPS Press. Another one is lucite reinforced ceramic, which is pressed into molds at high temperatures, and that produces restorations with improved marginal fit and strength. Another advancement is cast glass and polycrystalline ceramics. An example is die-core glass ceramic, which is a cast-like metal, but later it is strengthened via ceramic. And then there's polycrystalline ceramics. You must have heard of zirconia, that have no glassy phase. It makes them the strongest ceramic type. Now, CAD/CAM ceramics, which is computer-aided manufacturing, it uses digital scans and milling machines to fabricate precise ceramic restorations. Examples include Emax CAD, lithium disilicate, and zirconia crowns. And then there's porcelain veneers, thin ceramic shells bonded to interior teeth for aesthetic enhancement, indicated for discolored, malformed, or slightly misaligned teeth. Requires minimal preparation of 0.3 to 0.7 millimeters of enamel removal. And then the final one, which is the most common, is porcelain-fused-to-metal restorations, the PFM restorations. That's what we call it. So PFM restorations basically combine the metal strength and the aesthetics of the ceramic, and that's how they form the PFM restoration. So it basically has a metal substructure or coping that supports the porcelain and prevents its fracture. Common metal types that are used with it is high gold alloys, like more than 60% gold, and it has excellent biocompatibility. Then there are low gold alloys like 20 to 40% gold. That's more economical. And then there are other metal alloys used as well, like nickel chromium and cobalt chromium alloys. They're strong but can cause allergies, as you know already. And then there's silver palladium alloys. These are cost effective but may cause green discoloration of the restoration. So porcelain bonding mechanism with the metal is actually very important for you to understand. Let's talk about it. The metal surface is basically oxidized to form a chemical bond with porcelain. Remember, it's a chemical bond. And then the capillary technology helps porcelain fuse tightly to metal by controlling wetting and flow. A bonded platinum foil technique improves basically the adaptation by preventing the stress cracks. Now, although this is not really relevant for you right now, but you should know about the tooth preparation for ceramic and PFM restorations. So for an all ceramic crown, remember that we do around 1.5 to 2 millimeter overall reduction with rounded internal line angles to prevent stress fractures. The chamfer or rounded shoulder margins are preferred for structural integrity. And then for PFM crowns, buccal reduction is 1.5 to 2 millimeters for porcelain, and the lingual reduction is 1 to 1.5 millimeters for metal thickness only. So the metal collar or porcelain shoulder at the margin is left for basically aesthetics. Okay? Now let's talk about the clinical considerations and failures. Porcelain fracture is basically the #1 failure for PFM restoration, and that happens due to inadequate metal support or occlusal overload. And then there's marginal discoloration, which is also very common. It happens because of poor bonding or metal corrosion. Another clinical consideration for porcelain is the chipping of porcelain veneers. So we have to make sure that whenever we're placing the porcelain veneers, we cannot do that if there are excessive occlusal forces. So you basically need to keep these clinical limitations in your mind in order to take the right decision for your patient. That wraps up chapter 11 from McCabe, which is ceramics and porcelain fused to metal restorations. We covered everything from traditional porcelain to advanced CAD/CAM ceramics, PFM restorations, and clinical considerations. Ceramics continue to evolve. They're still evolving, and they're offering stronger, more aesthetic and durable solutions in restorative dentistry. If you want me to make a separate detailed video on the evolution of ceramics and how the advancements are further progressing, let me know. I'll make a separate video for you. I've specially made a separate quiz for you on this topic, so make sure you take that quiz. The link will be in the description. Thank you for tuning in. I'll see you in the next video. Take care till we meet again.